Welcome back to Insight. We're at Indiana Physical Therapy talking to Ben about the whole notion of getting physical therapy before I go into surgery, right?
Yes.
And that is becoming more and more standard, or just a really good idea?
I think both.
Yeah?
Either whether it's for somebody who has a knee problem, maybe an ACL, they usually will delay surgery for a couple weeks until they get the full range of motion back, or whether it's somebody who is having knee replacement and they just need a couple visits before they go in to kind of get some strength and range before they come out of therapy or come out of surgery.
Right. If I'm watching right now, I'm probably thinking my knee hurts. Why? Isn't physical therapy going to aggravate it or make it worse before the surgery?
Shouldn't.
Shouldn't, right?
Yeah. Working with that individual, we're going to tailor an exercise program to them that will help them move as comfortably and as well as they can before they have the surgery. Not everything's going to be 100% comfortable, but it will definitely make recovery easier and faster if they work on, improving their motion and strength.
So typically, and we'll just stick with the knee since that's the example you used, typically if my knee is stronger going into surgery, recovery is faster coming out?
Yes, and I would say that's, whether that's an example of somebody who goes in with an ACL, they're having an ACL repair, or that's somebody who's having a knee replacement, they will recover faster and hit the ground running, let's say, a little bit easier after having a bout of physical therapy before surgery.
Now, with direct access, I don't necessarily have to have a physician tell me to show up here, but typically is that the route in a case like this before surgery?
Yes, especially, if somebody has an ACL surgery, I find that, a lot of people will delay surgery until the swelling comes down, they get their strength back, they have their full motion, again, recovery is faster, and a lot of times surgeons will order physical therapy prior to having a knee replacement.
So what does it look like, how many weeks before, days before, maybe months before? How early do you want to see people prior to surgery?
Typically, we'll see somebody like a month before surgery, and then it depends on the surgery. If they're having a knee replacement, we might only see them once or twice. If it's an ACL repair, we might see them a couple times a week before surgery.
Now we're talking about knees, but I'm imagine this would be any joint replacement, kind of the same thing, shoulder, hip, even.
I think that it can. Yeah, and we've seen people who will have a couple bouts of physical therapy before having a hip replacement. So anything kind of. Yeah.
All right, so we talk about pre. Can you tell a difference afterwards? Because almost everybody then is going to go through post-surgery physical therapy, right?
Yeah, for sure. And not only in terms of range of motion and strength, but also I think they feel a little more comfortable, a little more confident in their, maybe some of the questions they had going into surgery we've answered, and so they kind of have a better idea of what to expect, and so they're a little bit more capable of performing those exercises easier.
Yeah, obviously if somebody's going in for knee surgery, their knee's not working properly, so you're going to accommodate what they can do based on the fact that their knee's not working, right?
And some things work, and you can use those things, and some things you have to kind of, tinker with and make it fit that person.
Yeah. All right. So 16 locations Indiana Physical Therapy has. It's pretty much anywhere you're watching right now. They're close. The best way to get this process started is to do what?
You can either go on our website, or you can give one of our clinics a call and just talk to one of them about setting up an appointment, or talk to your doctor too.
Yeah. If you'd like to find out more, indianapt.com is the webpage. We will be right back on Insight.